Okay, I believe we are live on Facebook. Yeah. Okay, good evening, everyone. And thank you so much for joining us for, Heather, if you could please mute everyone. I'm getting a lot of background noise. Oh, wonderful. Okay, again, good evening, everyone. Thank you so much for joining us today for this thought-provoking conversation on achieving health equity through community partnerships. My name is Nicole Myers, and I am the president of the National Council of Negro Women. And I am joined here with my partner.
Hi, I'm Heather Butts. How is everybody?
Good. Hi, Heather. And we have a fabulous discussion for you tonight. I want to first introduce you to Janetta Bell Kelly, who actually is a friend of mine. I've known you, Janetta, for how many years?
Let's see, since 2015. So what is this year? Like, it's all running into each other. So 6 years.
6 years.
6 years.
6 years.
Lifetime, though.
I know it does. So 6 years ago, Heather was working in New York for the Department of Health and Human Services, the regional director's office, and she left us and moved on to bigger and better things, and ultimately ended up at the Centers for Disease Control. And somehow we found each other on LinkedIn again, and I'm so happy to be reconnected with her. And so let me just give you a little bit of information about who Janetta is. Janetta serves at CDC, National Center for Immunization and Respiratory Diseases, Immunization Services Division. As a public health analysis, she co-leads the COVID-19 vaccine task force for disproportionately affected adult populations, racial and ethnic subunit. She's a project officer on various national organizations funded to reach disproportionately affected communities, as well as creating and building partnerships among diverse organizations and entities. In her public health career, Janetta's career spans across partnerships and outreach, health equity, public policy, community partnerships, building and health communications. She began her career with CDC as a technical writer and transitioned to HHS Region 2 as an Affordable Care Act regional outreach specialist. That's where I met Janetta. And later served as deputy director for the Louisiana State Department of Health Office of Community Partnerships and Health Equity. She served as the director of the Community Capacity Building Program. So as you can see, Janetta has a wealth of experience and background, and we're really looking forward to hearing really the perspective from CDC's messaging about what's happening with COVID-19, but more importantly, about helping us on Staten Island and across the state, helping us strengthen our ability to build community partnerships that really help to support us reaching health equity in our communities. So before we get started, we do have a couple of housekeeping rules. The first one is that this is on Facebook Live. So if you're on Facebook Live, hey, how are you? Please include any questions that you may have for Janetta or for myself or Heather in the chat. Both Heather and I will be monitoring that chat. In the room, if you're actually called into the Zoom meeting, please put yourselves on mute. There will be an opportunity for question and answers, and at that time, you will have the opportunity to unmute yourself and ask questions, or you can place them also in the chat, and we will read those questions at the end of Janetta's presentation. Heather, did I forget any?
No, you did not. Exemplary job.
Wonderful. Okay, so it is my esteemed honor and pleasure to introduce Miss Janetta Kelly Bell. Did I say that right? Janetta. See, Janetta Bell Kelly. See, I know her. I know
Bell
her.
first, and then Kelly, and then
Okay.
actually technically Bell again, but that's a whole nother Zoom chat. So just hanging out with Kelly for the kids, but you know, that's life.
You see, I know her as Janetta Bell, so I stuck with Bell first.
Well, thank you, Nicole, dear friends. And it's so nice to be here with you all today, well, this evening. It's so funny how, you know, with the pandemic, we're just on all these Zooms, and we were talking earlier about how our computers just kind of die out, and, you know, mine, I don't know, it's maybe on the last hair, leg, or whatever. So, you know, hopefully it'll hang in there with us, but thanks for being here. You know, you could be anywhere at this time on a Thursday in the evening. So I'm glad that you chose to be here. And even those out there in the Facebook island or wherever else you are, thanks for being here. So I'm a public health advisor, as Nicole mentioned before, for CDC. And I am just really excited about being back with the CDC at this unprecedented historical time. You know, first of all, as everybody knows, and preaching to the choir, we all know that this is a double pandemic that we're in. You know, it's the pandemic, COVID, and then it's also the social injustices and social unrest pandemic that we are dealing with right now. So to be able to shed light on the things that CDC is doing now to further the reach into communities of color and racial and ethnic communities, crossing all lines of religion, integrating all issues of sexism and just everything. You know, it's an honor to be working hand in hand with my colleagues, and that includes HHS and all of our community and local colleagues as well, all the grassroots organizers and folks who are really on the ground doing the hard work. We see you and we appreciate you so much. So I am just going to give you all a little detail about what we have been doing. I have slides, but I won't be able to see my notes if I do the screen. So I will, these slides are available to you all later after this presentation, but I will put some of them up, but I do need my notes pages.
So if you send it to me, then we can put it up for you.
Oh, you can do your own. Oh, do it from your screen, and then I can. Oh, yes. Why didn't I? You know, see, Nicole, that is why. This is why we are friends right here. So let me. Sorry, everybody. I should have mentioned this before, so that we could have come to this wonderful discovery. So Nicole, is it President?
President.ncnwsi.
Okay. Oops. Okay, it's not saved on this one. I'm sorry. NCNWSI.
At Gmail.
Email. Oh, Lord. Wait, President at NC.
President.ncnwsi at Gmail. Yeah, and then we can, as you're talking, we can share that.
Yes, that would be wonderful. So I wish we had some hold music. This will be quick. And it's nice to have an intimate setting too. So we have these little snafus, they can easily
Well, while we're here, we can provide greetings. I see Stephanie Chabot from Councilwoman Debbie Rose's office here.
And I went to
Stephanie. Hi.
Good evening, ladies. Hi, Miss Nicole. How are you? Miss Heather, how are you? Yes, I'm seeing, and lovely to meet you, Miss Janetta. I hope we'll all have a great discussion this evening. I'm anxious to hear what you have to tell us. So thank you for being with us this evening, and thank you for organizing this. Appreciate it.
Thank you for having us.
Thank you. I also saw Mr. Ed Josie, president of the National Council, NAACP, here as well. And I saw my NCNW sisters from Co-op City. I don't know, Heather, do you recognize some of the names?
Yes, I see some of my students. We're doing a public health incubator project in Health4Youth to have young people build their own public health project over the next 6 weeks. And so I see several of my wonderful participants who are here. I see Mert, I see Springy, I see a bunch of Valerie. So glad that they're here and they're taking advantage of a wonderful program like this. To be able to get some more information about public health. So glad to see all of you here. And of course, I see Ronnie. I see Ronnie. I see your Ronnie. Yeah. So yeah, I see lots of people. I see some other people, but I can't see their screens necessarily. So, but yeah, it's nice to see everybody. And Stephanie, it's been a little while since I saw you, but it's amazing to see you as always. Just leave me out there with some vegetables this weekend.
Janetta,
I need some vegetables. I got to go visit your garden.
Yeah, I need to be visited.
Yes, I have to do that. Okay, all right.
Right.
Janetta, I haven't received the materials yet.
Oh, wow. Technology again.
Mm-hmm.
See, let's make sure it's sent. Yep, it's sent. Not sure why. president.ncnwsi@gmail.com, right?
Mm-hmm.
Yeah, I don't know why. Well, I can just get started. And when you get them, just go ahead and because I'd hate to lose time. Well, first, again, preaching to the choir. We all know about the disparities in vaccinations. So in racial minority groups, it continues to be a public health challenge, as even Dr. Walensky has stated this several times, and we just know it just from doing what we are doing. I did get the test, Nicole. I'm not sure what happened. So one example, of course, is the flu vaccination rate. It's been consistently lower among adults in minority groups compared to the white adult groups. So, minority groups tend to experience greater health disparities that transcend low vaccination coverage. So this includes the disproportionate suffering of chronic diseases, and the health disparities have intensified, of course, since the beginning of COVID-19. So, again, just a little history we already know. And this has become an old and persistent problem among communities of color. Okay, there you are. Is that, did you do it?
No, I did it.
Oh, good, okay.
Mm-hmm.
Let's see. So if you could go to the 4th slide and.
Okay.
Can you put it on the slide? Oh, yeah, sorry.
The slide master?
No, the actual slideshow. That way you could just see the slide instead of the notes. Yeah, you could click that one. Yeah, and just go to 4. There you go. Thank you, ma'am. All right, so just to get started with the vision. So the vision of this program is to reduce the existing racial disparities in vaccination rates, and it also seeks to increase knowledge and positive attitudes toward vaccination through partnerships that will drive action at the community level to promote vaccination among racial minority groups. So the next slide. One thing that we have at CDC, one thing that we want to make sure that people understand first is the difference between equality and equity. As we teach, as we build community capacity, as we work with partners, we want to make sure folks understand what it means to have equal treatment versus equitable treatment and resources. So as we all know, you can look at this graphic and see equality means you're all given the equal advantage for something. So as you see those boxes down there, that's an equal advantage. Everybody has one box, but as you see, the people standing on the box still can't see into the field to watch the game. That's what equality is. Equity, on the other hand, is meeting a person at the point of their need. You see the first man is tall enough, he doesn't need to have the extra box soaring over everybody else. Whereas the person in the second column represents, an average amount of people in the community who, still need the same resources. And that last person, instead of giving that first person a box to be way over the, maybe considering as one percenters, that person has two boxes so he can equally see over. So that is what equity is. Again, it's meeting people at the point of their need so that they can receive the best health services and outcomes. Next slide, please. So the way CDC is going about achieving this is through the health equity strategy. So the Chief Health Equity Officer at the CDC, the COVID-19 unit develops a health equity strategy, which addresses health disparities and inequities in a holistic way. And this is a strategy that's on the website. So I'm not going to go too far into it, but I'll tell you the 4 basic principles. The first one is to expand the evidence base to increase understanding of the impact and the factors that led to disproportionate burden of COVID-19. The second one is to expand testing, contract tracing, isolation options, and care reaching populations that have been put at increased risk. The third is to expand intervention activities to support essential and frontline workers to prevent transmission of COVID-19. And lastly, to expand an inclusive workforce equipped to actually assess and address the unique needs of an increasingly diverse population. Next slide, please. So as the health equity strategy is underway and different centers within the agency are working hard to ensure that this is done. In the Immunization Services Division, a roadmap was created to get to this point of equity. So back in July 2020, there was a virtual session that was held with community leaders to discuss factors driving racial and ethnic disparities in adult vaccination. So the summary of the expert listen session was that it was a one-day session. There were 17 health, racial equity, and community leaders participating. And CDC listened to the individual experiences, and the takeaways that came from the meeting were: first, racial and ethnic disparities in vaccination should be addressed at the community level. Second, the community groups or influences should be equipped with culturally appropriate content. And third, the increased access, there must be increased access to vaccination. Next slide, please. So to reduce the longstanding racial and ethnic disparities, CDC is focusing its efforts on funding and supporting minority communities. And I wanted to mention earlier that I don't know if I think you do know this, Nicole, but I'm the project officer for NCNW, and I work directly with Janice Mathis and crew. We fund a lot of national organizations, and NCNW is one of them, as you all know. And I really enjoy working with Ms. Mathis and her team on building community capacity, working with local chapters, as well as beefing up the social media campaigns so that the information is going out. So I wanted to mention that earlier, but this is a great opportunity to talk about that.
And yes, I did know that. We actually spoke about that a couple of months ago, and I have to circle back with you on that. I was deployed at the time.
Right.
So my plans are to circle back with you on that. Yes.
Absolutely. But I did mention you to her. So she knows your name.
That's right.
All right, let's go to the next slide. So as you can see, this is, I call it the eyeball bubble. This just shows you the collaboration and support with entities at all levels that we have interfaced with. You see the program provides funding and support to partners at the national, state, local, and community levels who work to increase trust and access to vaccines among minority groups. And the next slide goes into detail about the organizations that we are actually funding at the national and state level. And you'll see NCNW over there on the left side, left bottom. So there are 8 organizations, 8 national organizations that are funded that have local chapters and affiliates. That's the ones on the left. The ones on the far right are other national organizations that work with community-based CBOs. The ones in the middle, you have the medical and professional associations and the other health entities. And then the other 2 recently added are the CDC programs and immunization partners. So if you see, we have already out the door has been approximately $150 million to these organizations and their sub-recipients. So the work is being done. It is underway, and it's very exciting. It's an exciting time. So that's just a snapshot of all of the national and state, excuse me, organizations that are funded directly. Next slide, please. Also, you know, we are funding state and local health departments. So this financial support is aimed at promoting vaccinations among adults in turn, and it will support approximately 70 health departments and health centers and 64 state, territorial, and local vaccination programs. So there are hundreds of, excuse me, community organizations, faith-based municipal governments, tribal epidemiology centers, universities, nonprofits, and local affiliations. Excuse me. Allergists sometimes get the best of me, so. Next slide, please. So as we began to talk to our partners and after we started funding and working with folks, you know, a lot of organizations said, you know what, we're happy to do this. We have the connections, but we don't really know where to start. So our team created this guide for community partners, which supports community organizations that play a critical role in understanding community needs and implementing strategies to increase access and acceptance of vaccines. And these this information is on the CDC COVID-19 page. I have some slides at the end that'll direct you exactly to where to go to get these. So the Community Partner Guide provides potential strategies and interventions to increase vaccine acceptance in minority groups, as well as publicly available resources, toolkits, and also data. And the guide is available now in both Spanish and English. So we're really excited about that. Next slide. So this is a really important part of it, of what we're doing. So the support for jurisdictions in expanding COVID-19 vaccination in primary care physician offices is crucial. The CDC recommended that at least 60% of the doses to be distributed to medical facilities be located in the most vulnerable communities. So to achieve the effort, CDC provides jurisdictions with an analysis of registered health clinics, and that comes from the census tracts that have the highest scores on the social vulnerability index. So CDC also is conducting ongoing analysis and incorporating new data to expand the list of physician offices that must be prioritized to include new providers as they enroll. The jurisdictions also receive guidance and have access to technical assistance to support the distribution and enrollment activities of the healthcare providers. Next slide. So this is DITA for short, Data Informed Technical Assistance. So one thing we do to help our organizations just keep going along and to sustain the work is provide data informed technical assistance. So it's data analysis and technical assistance to support and guide partners in planning and implementing activities aimed at reducing racial disparity. Next one. Another thing that we are standing up currently is a learning support for our partners. So we're providing training, support from subject matter experts, peer learning sessions, and a unified center to share educational materials and community resources. Right now, this is being stood up again, and hopefully it'll be completely underway within the first couple weeks of July. At first, it will be only for the funded partners, but we do plan to expand it to external partners, external communities as well, so that everyone can benefit from the resources as they engage with their communities. Next slide. So one of the major things we're doing is deploying communication. You know, social media, as we know, is everything. You know, we know that some people don't even watch the news. Social media is the news. You know, what they see on Facebook or what they see in these messenger chats or all this information that they're getting, whether it's true or false or misleading, it's still the law to them. So what we're doing is sharing communications to support long-term efforts and build confidence in vaccines among minority groups. So we are addressing misinformation disseminated on social media and seek to promote accurate messages about vaccines. Next slide. So I'm getting to the end of the community engagement portion of it. I just wanted to show you what our national partners had going on this spring. This is just a little clip from some of the organizations that have reported back about what they've been doing. So the National Alliance for Hispanic Health, they had a graphics-based social media campaign promoting hand washing, mask wearing, and social distancing. The National Minority Quality Forum also had a robust social media campaign hosting 4 webinars. The National Urban League, some of you may have heard of some of these things going on as well. Virtual town halls, informationals, and webinars. Unidos US had the Esperanza Hope for All campaign, which is a mobile marketing tour, and National Council of Urban Indian Health also created social media toolkits and partnered with UMBC to administer vaccines to urban American Indian and American Alaskan Native people living in the DMV area. So that's just a little bit of what has been going on. So much has happened since then. If you get to that next slide, this is kind of a picture of more of what I just said. You know, these are all the national organizations. I believe there's all 12 of them up there. 2, 4. Yeah, I believe all 12 of them. I can't count right now, but that's just more of a snapshot about what has been going on. As you can see, NCNW has a new relationship or a new partnership with the Divine Nine. It is something that is brand new and something that I'm proud to have created an opportunity for and spearheaded with Janice Mathis, and we're looking forward to being able to fund program activities because we all know the Divine Nine is the backbone to a lot of communities. So we're really excited about this an unprecedented partnership like this with COVID-19. So, but as you can see other organizations that are doing great things, vaccination events with the most vulnerable, memorandums of understandings that's being drafted, policy things that are being implemented to make changes. So that's a snapshot of what there is, what's happening out there. So if you go to the next slide, the next 3 slides are resources.
I just want to say that's great about the
Oh,
Divine Nine. We do have, you know, a chapter, the Delta Sigma Thetas on Staten Island already. And the Hidden Pearls Alpha Kappa Alpha has an interest group that was recently established on Staten Island. So that's
wonderful. Yeah.
exciting.
It is. And one thing, and I take that back, one thing Janice told me was that a lot of local chapters worked with Divine Nine, but I think this was the unprecedented part of it with, you know, the national, at that level, working with Divine Nine. So they're really excited about that. But these next 3 slides are resources. So I know there's a question, I think it's one of the questions that you fed to me, Nicole, about resources. So these 3 next pages here are everything you need to know about these topics. Well, not everything, but you know, it's being updated all the time. But these links, hyperlinks, go directly to the areas you need to go. First, with discussions with parents about vaccinating children. The new information about, the new information will be posted about the new side effect that has been reported, the myocarditis or the pericarditis, the messaging geared towards single female heads of household. Go to the next slide for me, Nicole. The clear communication to address the fears and language barriers of undocumented communities, which we know is a big thing. You know, a lot of undocumented communities have admitted to not wanting to get vaccinated because they didn't want to be deported, you know, because they, you know, some of them have been targeted and asked for their papers, you know. So we have a whole team working on making sure that doesn't happen, so that if they want to get vaccinated, they can. Also encouraging employers to accommodate time off for vaccinations, recovery with minimal disruption to the financial stability of low-income households. And that last one is, the last slide on the resources is the guidance for influencers who are formerly vaccine hesitant. They've taken the vaccine to articulate their reason for this change without exposing them to backlash. So a lot of great resources. All of these are hyperlinks, and I'm sure they can, you all can get this information. Nicole, I'll send you, or you can save these or I'll send them to you, whatever works best.
Okay, you sent the PowerPoint to me, so I can definitely share it with everyone who has logged in.
Perfect. Yeah. Actually, let me PDF it and then we can send it out that way. So if you go to the next slide, just wanted to give you a little piece of what our long-term approach is in addressing racial and ethnic vaccination disparities. So, you know, you could see in 2020, the implementing activities with the focus on flu vaccine, then the scaling the activities for COVID-19 vaccine through this spring and onward, and evaluating and improving flu and COVID vaccination activities, and then expanding the focus to close gaps across all adult vaccines onward and upward. So, you know, this goes way beyond COVID, it goes way beyond flu, and we're looking forward to continuing to work with you all and all of boots on the ground organizations about, you know, not only receiving vaccines, but educating their families, community members' families, and ensuring that information about chronic disease prevention, you know, is out there as well, so that, you know, when the next pandemic rolls around, possibly health and health outcomes will be different for different populations who are most vulnerable, because you've been educated about chronic disease prevention, which means that maybe if the next one comes around and it's just as deadly for African Americans or people of color who have underlying conditions, maybe those conditions will be changed by then, and it'll give people more of a fighting chance. So that is the end of the community engagement portion. On slide 25, if you go two more slides, there's some more information about COVID-19 vaccinations. But I just want to pause there because this kind of goes into the Q&A portion of it. You know, I want to share this information, but I also want to pause and, you know, I know the time is going and I just want to make sure, do you want me to keep going about this portion of it or should we take a pause?
Yeah, I think we should take a pause and I skipped ahead somehow, but I think we should take a pause and see if there are any questions from the audience.
We have one question and then we have questions that are pre-screened as well. So do you want to ask a few of those first?
Okay.
Okay. I think our guest knows what we're gonna ask. I'll just ask a couple and then definitely the safety information you're about to give, I think is gonna be critical to people. The first question we have from the audience is, it's sort of a corollary to what you were just talking about. So the question is basically, do you believe the worst of COVID-19 pandemic is over? But I think the sort of add on to that is what you were just talking about in terms of the next pandemic, which, you know, I mean, I don't mean to be gloomy and doomy about it, but I mean, we will see another one because history tells us that we will. Ebola in 1918 and SARS and so forth. So the corollary of this, or the add-on to that question, do you believe the worst of the COVID-19 pandemic is over, would be, and are we ready for the next pandemic, I would say. So what are your thoughts?
Nobody knows if the worst is over. What we do know is that moving forward, it's a few things that we have to look at. First of all, going into the fall season, when the flu will be at an uptick. So you're combining flu with COVID because COVID's not going anywhere right now. So just let that be perfectly clear. It's not going anywhere. So when you combine flu with COVID, then you combine the environment which COVID likes to live, which is cold temperatures. When you combine the vaccinations, the percentage of vaccinations, the percentage of those who are not getting vaccinated, you know, we just have to look at a few things. We also have to pay attention to how we approach these upcoming holiday seasons. You know, a lot of people, we're getting out, we're ready to be outside, we're happy, we're vaccinated. Well, some of us are vaccinated, some of us are not. And the thing is, I think we have to remember, you know, CDC guidance is put out there regarding mask wearing and you know, you can not wear masks or you're free to, you know, don your mask or not in some settings if you're fully vaccinated. And, you know, we have to remember some people are just going and doing their own thing, whether they're vaccinated or not. So we have to be cognizant of the fact that everybody is not doing what they're supposed to do, but a lot of people are. So as far as the worst being over, you know, hopefully yes, but we really don't know. We don't know until, you know, we see more vaccinations. We see how this flu season works out with everything. So, you know, honestly, the transparent answer is we don't know. We don't know if it's the worst is over, prayerfully so. But, you know, it's just important for us to stay diligent in educating communities about vaccination so they can make the right decisions for their families, you know, and get vaccinated. So hopefully the worst will be over. So I hope that answers the question.
It answered it for me. The second question has to do with messaging around the vaccine, which is actually of interest to me because that's an area that I do my research in, looking at messaging and different kind of messaging for different populations of people. And I noticed that you actually spoke about messaging and different messages coming out of the CDC. Maybe you could talk about that a little bit more in terms of messaging and what the CDC has found as being effective in terms of getting information across to different populations of people. Do you find different populations respond differently to different messages? What are your thoughts?
Well, I can tell you one thing. The biggest discovery or something that's the most influential is not just the message, but who the message is coming from. It's more about the trusted messenger than it is the message. I mean, just think, you know, when you look at the news, you see Dr. Fauci or you see some other scientific medical person who is a wonderful scientist or a wonderful expert. They're talking about COVID-19 and vaccinations, but, you know, a person, different communities may not relate to Dr. Fauci. So they might be like, well, I don't want to, I mean, I'm not listening to that man, you know, so it's all about trusted messengers. And that's one thing we are working really hard to ensure that organizations are building or first equipping trusted messengers. And trusted messengers are, it's the old man that owns the bodega down the street. It's your CNA. It's your local, it's your faith, your pastors, it's your deacons. It's the first lady of the church. Those are the trusted messengers. And, you know, we are equipping them with the information that they have. All the information is on the CDC website. So, you know, making sure that they understand this is the information, this is the data, this is how I need to communicate it to the populations that I serve or the populations that I consider my village. I think that's the most pivotal part of this whole outreach and engagement, is ensuring that people who look like people of their communities, people who can relate with the people in their communities, have the message and that they're delivering it in the most culturally appropriate way, you know, so that the message can go forward. So that's the biggest part of it. And, you know, again, with the other side of the messaging, making sure that, you know, all of the mis and disinformation is squashed, making sure we're doing a lot with national organizations to search for information that is not true or search for misleading information, and to make sure that we correct it and catch it, and so it won't spread, so it won't keep going. You know, we all see these messages with, you know, these rogue scientists or doctors or whomever spreading just untruths about the vaccine, or just creating all kinds of confusion, really, about the vaccine and the contents thereof. And, you know, so it's really important that trusted messengers have the information, they have the facts, and they are bringing it to their community so that everyone has the information they need. Does that answer your question?
Excellent, excellent. Okay.
So, wait, I have a follow-up actually to that, that Stephanie Chavot had asked.
Exactly.
About, oh, you were going to that question?
Read my mind. Exactly. You got it.
You know, one of the other people that I think about that are important are those community leaders in the neighborhood, right? Who, however, you know, they show their face, are critically important to trusted messaging. So Stephanie Chavot asked, or stated in the chat, in this area, in North Shore of Staten Island, we found the most resistance to vaccine to be among low-income young men under 25. Are there any strategies that CDC has identified that's successful in reaching this population?
Actually, yes. So in addition to social media, you know, we already know how social media is, you know, that's the Bible for a lot of people. So, you know, I already talked about what we're doing with social media. But in addition to that, we are building new partnerships with doctors and with Black doctors, with Hispanic doctors, with doctors of all cultures and ethnicities, as well as science experts, to bring information in a non-traditional way. So that's your barbershops and your salons. It's similar to what the Obama administration's My Brother's Keeper initiative was, and still is. I guess it's still going, you know, but of course separate from the Obama administration. So it's using those methods of reaching them, talking in plain language. You know, there's one physician, Dr. Dan Fabui, He is a Nigerian American physician who is excellent at that, bringing a new perspective or bringing the science. He's an ER physician, but he's also an expert on COVID-19 and vaccinations. He's participated in all the studies. He knows all the information about it. And if you look him up, you'll see that it's different approaches to talking to people and to relating. And we find that in the population of young men, especially young Black men, we don't have the hard data yet, but we do see that, like on social media, we might have more impressions from populations whenever that approach is taken of the homeboy, we're about to rap about this. I'm about to tell you about these vaccines. If you have some questions, ask me about it. Don't go thinking this or that. I'm your reputable source. I'm your plug. Using language and using again just engagement methods to reach out to the younger generations and especially younger Black men. Again, the data is still coming in, just like with everything else. But we believe that method is going to really reach a lot of people in that age group.
Heather, thank you so much for that, Janetta. Heather, are there other questions that have come in?
We have another pre-screen question, which you kind of alluded to, and it is the work that the government's doing to help diverse communities get access to the vaccine. But maybe you could give a little bit more information, because you actually mentioned something really interesting that I heard people talk about, which seems like with all the accommodations that are out there, it shouldn't be an issue anymore, but it is a huge issue still. And it has to do with work and people being able to take time off both to get the vaccine. And then obviously people are concerned about side effects. So if you have to get 2 shots and your concern is I might be out of commission for a couple of days after each shot, and maybe I work weekends and I'm going to get the shot on Friday, so weekends aren't going to help me. What do people do about sort of that kind of accommodation? So how's the government helping with the access, and what do people do in terms of work?
Yeah, that's a good question. And, it's kind of a hard situation because, as a federal agency, we can't require anyone to do anything, first of all. And when it comes to organizations, businesses, a lot of information or a lot of their policies and regulations come down from the states. And then even further than that, people still making their own rules and they can break their own rules. And, if it's not reported, then it's just like, oh, well, I get written up because, I couldn't make it on my shift because I just had my vaccine and I wasn't feeling well, but my boss wrote me up and so what do I do now? And I think the problem is too, a lot of people are afraid to report some things and they'll just take it like, oh, well, it is what it is. I'll take it to the chin and just deal with it. But one thing that we are doing is speaking with our states, all the jurisdictions, and just encouraging them to work with their health departments, work with their local officials to try to protect citizens, from any backlash that could come from their employers. Again, it's nothing that's guaranteed, but we do highly encourage them to work with their employers, create a safe space for those who do want to get vaccines so that they can protect their own lives and the lives of their customers, when you really think about it. So again, it's coming from the federal government. It's advice, it's, suggestions. Nothing can be necessarily etched in stone or enforced. So it's just important that we just continue to work with our local health officials and health departments and educate them on the side effects, what actually happens. Know that, just because somebody says I'm calling out of work because I just got my vaccine, know that these symptoms may be causing this person to feel really bad. And, it is true. They may not be calling out to work. We know that some people will abuse the system, but, it's important that employers know that these are the side effects. You might have chills or fever one day, or, you might just feel really weak and tired. And then that on top of whatever your chronic illnesses or whatever your situation, your hormone, whatever, it might affect something else that, might cause you to feel kind of crummy a day or two. And so we are encouraging, again, health officials and local health governments to just be cognizant and compassionate.
Okay.
Thank you.
Yeah.
Oops.
So I see we have about 5 minutes left. So maybe, I know you have more of your presentation. So
Yeah, actually, I can just glide over some of this, but these are some of the questions that I figured might pop up. So just some quick facts about vaccination. First of all, of course, getting vaccinated can help prevent getting sick with COVID-19. It does not prevent you from getting COVID-19. So I just want to make sure everybody understands that, because we've gotten a lot of complaints. I got my vaccine, but I still got COVID-19. It's just like the flu. It's just like any other, as far as the vaccine, it doesn't mean that it's going to prevent it. It means that if you have the vaccine, it will most likely help you not to be really, really sick or pass away from it. So I just wanted to first talk about, just get that out there.
by the way,
and
that's
also-
great. That's
Go
a great point. The New York Yankees are a good example of, over 18 members getting sick because they were vaccinated, but they all ended up testing positive for COVID. So I think that was a wake-up call for people to see that, it will protect you from getting very sick, but it may not protect you from actually testing positive for COVID and having COVID.
Absolutely. And then the other side of it is people who had COVID still need to get vaccinated, because this is so new. We don't know how long your body will be able to fight the infection with the antibodies that it has developed from having COVID-19. So it's important. Like, I had COVID in March, and thankfully my situation was just like a very light, thank God. Because but even with what I experienced, I was about to lose my mind because I lost my sense of smell. But that's a whole nother story. But anyway, but I just got my second vaccination a couple of weeks ago, and it's very important that people understand that no one is immune. Like, I've heard that a lot, especially in the younger population, young men. A lot of young Black men feel like that if they had it, then they are immune from it. So it's really important for people to know that, nope, you're not immune. There's no science that points to immunity of COVID-19. Another thing is COVID-19 will not give you COVID-19. The vaccination will not. So this is another thing we wanted to make sure everybody understands. The new vaccine is the mRNA vaccine. That means that whenever that shot goes into your arm, there is a list of instructions that is given to the other cells inside your body to identify the vaccine to identify COVID-19 if it ever comes into your body, and to know how to fight it. It does not go into your DNA. It does not enter into your nucleus. All those rumors are not true. It does not change anything about your DNA. It doesn't even touch your DNA, but it gives instructions to other cells on how to fight COVID-19 if you do happen to contract it in the future. But again, it's not a live or dead virus that is injected in you like with some of the other vaccinations. It is a list of instructions on how to fight it. So I wanted to, make that point crystal clear for folks so they understand that, if you get the shot and you have some side effects, doesn't mean that you have COVID-19. It just means that your body is working. All the instructions are working because your body is working hard to fight it and build up an immune response. What was the other one? the COVID-19 vaccines will not cause you to test positive on COVID-19 viral tests either. Again, it's a list of instructions. It's not a live virus. So that was something that that was coming up a lot a few months ago. You know, you would not test positive after getting the vaccination, you know, just from the vaccination. Now, if you had COVID-19 and didn't even know it and you got vaccinated, then yes, you would test positive, but that's not from the actual vaccination. So I wanted to, you know, make sure folks know that those are lots of rumors going around, and I just wanted to make sure. Oh, another one is about booster shots. We don't know. We don't know if we're going to need boosters. We're still trying to figure it out. The scientists are still working on it. Data is still coming in. We don't know if we might need a booster. So it's a lot of rumors about I'm going to go get my booster shot in January. Actually, my line sister said that. So I'm a Delta, and my line sister was like, okay, so I'm going home for homecoming from Louisiana, Southern University Jaguars. So, you know, HBCUs, we all know that homecoming and Bayou Classic, that's a big thing for us. So she was saying that, you know, I'm gonna go ahead on the homecoming and the Bayou Classic. And when after that, I'm gonna go ahead and get my booster shot. And I was like, wait, hold up. No, hold on. That's nope, you know, there's no booster right now. We're not talking about that. So just so you know, we don't know if we're getting having or needing to have a booster. Another question that came up was about the different variants of COVID. There are 6 variants right now. And as for right now, what science tells us is the drugs that we have approved here, which are Pfizer, Moderna, and J&J, are effective in treating COVID-19, not treating, but they are in preventing COVID-19 in the States. Now, there are some of the other drugs in different countries like AstraZeneca. We don't know if all the variants will be able to be prevented by that one. So, you know, as far as we are right now, you know, the vaccine is working with all the variants, but you know, again, science is still going on. And
Janetta, I think another thing that is important to remind folks of is that to complete the vaccination process, right? So you hear very often that people are getting the first vaccination of Pfizer and Moderna and not going back for the second shot. And it's important to complete it. I know not for myself personally, but I do have some friends that went to a function, some that were fully vaccinated and some that were partially vaccinated and some that weren't vaccinated at all. And it just so happens that somebody at the party ended up being COVID positive, which impacted many of the people that were at the function. Those that were fully vaccinated, some of them didn't even get a cold. Like they actually went and got tested just because they knew that someone was positive. So they went and got tested, but they wore masks because they had family members at home. So they wore masks for 2 weeks, but they actually never even got signs. And then there was some that had partial vaccinations that ended up with pneumonia because, and we believe it's because, you know, they just never finished completing their cycle of vaccination. It could be wrong, you know, I'm not CDC, but
the ones who were partially vaccinated, they had COVID and ended up with pneumonia, or they
ended up positive with COVID. Not all of them ended up with pneumonia, but those that were partially vaccinated and those that were, so some never tested positive, but for the ones who went to the function that ended up being tested positive, that had partial vaccinations, they got very sick and up to pneumonia, like very, very sick, high fevers, all the way through to having pneumonia. They were not hospitalized. They went to the hospital, a couple of them, but they didn't require hospitalization, but still they got very, very sick. So
Yeah.
I think, the importance of stressing the importance of completing those vaccinations is very important.
Right, and I'm glad you brought that up because the studies are based on a complete vaccination, which is both doses, and you have over 90% effective rate for a complete dose, which is 2 for Pfizer and Moderna and 1 for J&J. Well, J&J is a little less, actually. It's I believe 68% effective.
60-something, yeah.
So it's very important, to go ahead. I mean, why would you stop? Why wouldn't you just get the second one? And I think some people have good reasons why. Some might not have been able to get off work again to go get it done. It's a lot of different life situations happening. But for those who just like, oh, I ain't going back for that. Don't do that. That's just, no, don't do that. Just go ahead and get the second one. Be done with it. But yeah, the full effectiveness is from the complete dose. So please keep that in mind. Were there any more questions? It was a couple more things just about the safety standards, the EUA. I just wanted to make sure that everybody knows that, people are concerned about the process or how quickly it went. Just to, again, to clarify, every step was followed. Every single step was followed in the testing the safety, effect, efficacy. All of those steps were followed. It's just that a lot of the red tape that normally is a part of the process, which could be, anything that deals with paper pushing or, all our wonderful government people that know about dealing with, different, getting signatures here, all of that stuff was put to the side. And another important thing to know is that these, the research and the work had started way before with mRNA vaccines. So most people might not know that mRNA vaccines are present in cancer treatments. mRNA was researched to work for flu and rabies, so this is not new. None of this is new. Scientists have been working on this for a long time. It's just that with COVID, it was like, oh, here we go, mRNA, let's get on it and let's push this process, and get it going. So, I don't know if that was the music to go, but but I just wanted to let you all know that the process, there were no steps skipped. I know that it was such a controversial, highly politicized situation, but none of the steps were skipped. I saw a question that just popped up. Has the vaccines been approved by the FDA? Yes. So everything that is being administered, those 3 vaccines are, under the emergency use authorization, and they're safe. They're safe for people to use. And when you look at the populations of people who have had the vaccines and look at the data that shows, folks who got the vaccine, and you see the numbers. Remember how when this whole thing started, the numbers were just going up and up, and it was just like, oh Lord. But now we see that it's started, it's plateauing and even going down in a lot of areas with hospitalizations and different other adverse effects. So yeah, those were the main points that I just wanted to make sure everybody understands. Were there any more questions? I know we're at time, and I'm respectful of everybody's time, but I just wanted to see if there are any more questions, or if there are more questions, you can tell me, and I'm happy to. If I don't know the answer, I can find it for you. Nicole, did you guys see any more questions in the chat?
I think you got the last one with the one that you got about the vaccines. There was a question talking about somebody who was hesitant to get the vaccine and then getting the Johnson & Johnson vaccine, but you.
Oh yeah, okay. I'm just glad. Yeah, I missed that part. Okay, so J&J. All right. So first of all, I just want to point out to you all how transparent the government is being with this process, first of all. And I think this can help people understand that it's not some kind of wool that's trying to be pulled over anybody's eyes. Nobody's trying to trick people into doing something so they can kill them. You know, things are reported that are happening as soon as they happen. So with J&J, for instance, so the issue with the blood clots and it being primarily in women aged 18 to 49, that has been compared to the same effect that birth control pills, as far as the numbers. So just like with any other drug that you take, vaccine, the side effects have to be reported. So those side effects were reported through CDC's two systems of VSafe and the Vaccine Adverse Event Reporting Systems, and they were put out there so the public can see it. So the vaccine is still safe. The J&J vaccine is still safe. Now, but one thing that you have to realize is that there are side effects that we want to make sure that everybody is aware of. Again, if you are between the ages of 18 and 49 and you're a woman, you know, you have a chance, a very slight chance, you know, of the blood clots that are associated. I believe the number was 6 out of a million, 6 people out of a million. I might have that wrong, but I know that it was a very small number. And I mean, any number is enough, you know, I understand that too. But, you know, just so you know, you know, and my mom always says, use your common sense. So if you have the option, if you're a woman between 18 and 49 and you feeling still kind of hesitant about taking J&J, just take the other two, you know, Pfizer and Moderna, you know, but know that they are safe, but it comes with that side effect or that risk possibly. But if you still feeling, you know, like you don't want to try that, or if you know that you're at risk for thrombosis or you have blood clots in your family, or if you know, if you're at risk, then choose the other ones. You know, just consider the other ones.
Janetta, another one that came up says, has the vaccines been approved by the FDA and why not? So I know there's an approval process, right, for final approval. Like they've been approved for the expedited process, but there's final approval, which includes doing some after following patients for a certain amount of time. So it couldn't be approved except for through the expedited process, because you have to follow the patients for like 6 months or something, and then they have to submit, Pfizer and all of them have to submit some additional data reports before they get full-fledged approval, right?
Right, and that's the, I wish I would have thought to invite our FDA colleague who talks, he speaks directly on that, Dr. David Cho. I meant to tell you about him, Nicole. He can actually talk more about that process, but it is, like you said, it's behind the data and the following of it. You know, like how I said, the emergency use authorization is something that helps you get past the red tape or the things that'll kind of hold you back from bringing the vaccine out to the public to actually treat or to help prevent. But I'm not gonna speak on that because I don't want to give any false information, but I can get that information for you. I know the answer is out there because my colleague spoke about it on another panel that we were on. But my apologies for not bringing that information. But I'll make sure I get it.
Well, maybe we can make that another topic for our educational 1-hour educational series.
We're not limited.
That.
He'll come back too.
He'll be happy. Dr. Cho is wonderful. I don't know if he's out there watching somewhere, but he's a wonderful, he brings the information. He talks about the entire regulatory process. He knows every nook and cranny of it all. So he is your go-to person to understand the EUAs, the entire process of testing and you know, the trials, all of it. So yeah, so you know, yeah, I'd love to provide him as a resource. Look, I'm just volunteering the man, but you know, I can definitely reach out to him for you, Nicole.
Okay, that would be wonderful.
Offline about it.
It would be great too, because with the, with the increase in the Delta variant and people's concerns about some of the other FDA approvals, and Nicole was talking about what exactly an approval means and EUA versus, post-marketing. I think having him and you back would be really fabulous.
Awesome. We're here to serve.
Okay.
Thank you, Janetta. So I think we're way over our time. I mean, this has been so engaging, and I'm so appreciative of you, my sister Jonetta. I would hug you right now if we were in the same states. Thank you so much. Thank you so much for joining us. You were going to say something?
No, I was just saying thank you. I'm glad we connected, and that LinkedIn, I tell you, that thing brings you all together. I tell you, but
yes, it does. Yes, it definitely does. So, the significant challenges, as our families are facing and communities today really demand that we work together. We had an event just recently, Juneteenth, where 50 Black organizations on Staten Island held a Juneteenth event that was phenomenal. And I'm really hoping that the energy that was expressed there, that we continue to use that energy to sort of, dig in deep and start doing the work around health equity and supporting our families and, strengthening our ability to change some of the outcomes for our families right here on Staten Island and across the state. And that's for my other NCNW sections sisters that are out there also that joined in on this call. So I want to thank you again for joining today, Janetta, and providing this valuable information. I know you gave you included your contact information on here.
One of those slides.
On one of the slides. So, but I'll send it out. I will send out you're going to send it to me as a PDF, right?
Yeah, I'll send it to you as a PDF. Yes.
Okay. And we will definitely share this information. I've gotten some private messages about some of my other sisters that are interested in you doing a similar presentation for their organizations on Staten Island. So we'll be reaching out to you to talk about that as well.
Absolutely.
Heather, you got any last departing words for us?
Yes, we just put a form in the chat that is some information gathering about how we can improve future presentations, although I just don't know how we can improve upon this one. But if you could please fill that out for us, it'll be helpful information that we can use for our next panel next month. And we'll be doing these monthly until forever.
Yes, and so if you have any topics, like Heather said, if there are any topics that you want to hear about, we already know that the FDA approval process is one of them. So any topics at all that you want to hear about COVID or unrelated to COVID, health equity, whatever it is, we're here to serve. Please use us as a resource to be able to do that. And we look forward to connecting with you soon, the last Thursday of the month for 1 hour power session. This is a little over that. 1 hour power session.
Hour and 17 minutes, power session.
Okay, thank you all so much for joining us.
Yes, thank you. And thank you to our amazing speaker, who we will definitely try to see again, maybe next month.
Absolutely.
Great.
Thank you. Thanks again. Take care, everybody.
Bye.
Bye-bye.